Aloha from the Ninth Island, Las Vegas, Nevada. Thank you for the introduction, Kara. It is my honor to be part of the Project Echo and excited to get to know everyone on this platform. Thank you for joining us and taking the time to know about racism in nursing and what we can all do about it. So today we will discuss and learn together about tools to address racism in clinical practice, confronting racism on the unit and at the bedside. First, I would like to ask if you are connecting from the East Coast, can you raise your hand? Some are thinking about, am I from the East Coast? Okay, what about from Central Region? Okay, the East Coast, please put down your hand so I know how many are East Coast and how many are Central Region. What about from the Midwest? Looks like we have a lot of people from the East Coast. Okay, what about West Coast? Okay, well, that's a nice game, right? To start this series, this section. I wanted to see where everyone is coming from to better understand everyone's perspective about a topic. We sometimes neglect the geographical area where we come from, which really make a difference in how to understand each other. Because what's normal in one region may not necessarily be normal in another one. Racism in nursing, in healthcare, is it really happening? Does it really exist in clinical practice in this modern world? Can racism happen between nurses in clinical practice? Let's try to do some self-reflection and observation because it's important in clinical practice. As I prepared for this presentation today, I found out different ways we may address and confront racism in nursing. Some of us may have already think we figured out how to identify racism, address racism, and confront racism. However, they are not always effective and sustainable because every situation is different and every person is different. Can racism happen between healthcare providers? You bet. Between healthcare team members? You bet. Because we are all unique individuals with different backgrounds and upbringing. What is considered an everyday normal heated conversation in one culture is considered normal to them, but not to others. The intentions may be good, but it is in the perception of the receiver of the message in words or in actions that matters. Can racism happen between patients? Of course. So what do you do as a nurse when a patient is racist towards another nurse? Maybe occupying the same hospital room, maybe in the same unit, and then all of a sudden there's this altercation happening. What do you do as the nurse? Well, there's this guy named Daniel Sokol, S-O-K-O-L. He is a medical ethicist and a barrister. I had to look up what barrister means. It means a barrister is a type of lawyer in a common law jurisdictions. Barristers mostly specializes in courtroom advocacy and litigation. So he's often called, Daniel Sokol is often called the ethics man. So he published this article, and this is from his article that I'm showing, article called Dealing Fairly with Racist Patients. And he talked about this hospital called North Bristol. And this hospital launched this campaign called Red Card to Racism campaign. Does anybody heard about it? Probably not, because it's in England. So this is a campaign. This is how it goes. Any offending patient first gets a verbal warning. It's a yellow card. Then, in the event of repeated incident, they will withdraw treatment of this offending patient, and then they get issued a red card. So out you go. So That's how that red card campaign that we talked about in this article. And he also talked about examples of outward patient displays of racism, from name calling to requests for a clinician of a particular ethnicity. Sounds familiar? So he said that clinicians should be able to exercise judgment. And in most cases, overtly racist patients should be told that their behavior is unacceptable. When and how this is done will depend on the circumstances. I remember when I was working as a nurse case manager at the Queen's Medical Center in Honolulu, Hawaii. This native Hawaiian patient was yelling on top of his lungs that he is not leaving his hospital bed because Queen Emma and King Kamehameha IV founded the hospital in 1859 for the Hawaiian people. So no white person, no brown person, no yellow people can tell him to go home when the king and the queen said, this hospital is for the Hawaiian people. Is this considered racism? I'm not sure. I don't know. What do you think? This patient was waving around a laminated proclamation about the Hawaiian people. Can anyone guess what was my course of action is as a nurse case manager? Just take a guess. But I was able to discharge this patient after lunchtime for those who are case managers. Yes, someone says happens here in Southeast Louisiana, depends on the policy. That's right. I was able to discharge his patient after lunch. So what I did is I called the vice president of Hawaiian Affairs because he knows about Hawaiians, right? So he came at bedside and talked with the patient calmly and collectively. And by the way, our vice president of Hawaiian Affairs is Hawaiian, Filipino, and Chinese, and he is a neurosurgeon. So let's ponder upon the definition of racism. I know that it's been talked about a lot. So let's look at the definition of racism by the National Commission to Address Racism in Nursing. As you notice, I color-coded the significant words looking at us. Assaults on the human spirit in the form of actions, biases, prejudices, and an ideology of superiority based on a race that persistently cause moral suffering and physical harm of individuals and perpetuate systemic injustices and inequities. So if you notice, the color-coded assault is equivalent to attack on the whole well-being, holistic view of individual mind, body, and spirit. What's the time frame of this attack? Persistently. I think it's very important to ponder upon each word. Perpetuate means to continue indefinitely. Wow. Okay. Racism. So from previous presentation during ECHO Project Series 1 and ECHO Project Series 2, by now we have established that racism exists in nursing and in clinical practice. What racism is can also be subject to interpretation. And what merits a red or a yellow card won't always be clear-cut. There are situations when a patient's racism behavior justifies a refusal of a health provider to treat, as long as the patient is medically stable and not in immediate danger. What to do with overtly racist patients should depend on the facts of the case, on the patients and the medical circumstances, the nature of the racist behavior, the reasons and motivations for the behavior as far as they can reasonably ascertain. And what, if anything, can be done to resolve the problem? What do you feel when someone says, can I have a white doctor for the operation? For those who are not white, that hurts. It's just like am I not good enough, right? Everyday racism is racism, but not all racism, everyday racism. From everyday racism, there is no relief. Racism is not the same as
She's gonna be waiting a long time. I can't get out because she's sitting back there.
Oh. Or racial prejudice, because racism involves a series of systems embedded through institutional policies and practices in society that ensure that one group has the power to discriminate.
Said, come on, I ain't going back there.
That is according to Simster and Ray. So before we can truly address racism in nursing or in general, we need to know what it is. What's happening? And sometimes I say to myself, what was that? Because I could not believe it is happening to me or to others right in front of my eyes. Until then, we can truly identify and even create tools to address racism in nursing that's effective and sustainable. Racism in clinical practice have an impact on the learning opportunities of students, not only in nursing, but in all students in healthcare field. The lack of a structured approach to redress discrimination causes a lack of inclusivity and equal access to clinical education. I read this study that was done in South Africa, wherein language was used as an intentional barrier to isolate students from the patients during work-integrated learning. The emergency care providers would intentionally speak a language not understood by the student and failed to translate vital medical information about the case. So what happened is this conduct prevented some students from engaging in clinical decision-making during their training. So let's talk about overt racism versus covert racism. Overt racism or explicit racism is the intentional and or obvious harmful attitudes or behaviors towards another minority individual or group because of the color of his or her skin. Overt racist actions are those that are the easiest to see and described as racism, unlike the more insidious or covert forms of racism. Now, the covert racism is racial discrimination that is concealed and subtle rather than obvious or public. This covert and overt actions towards the individual who is the target. That target is the one to be silenced, invalidated, and not heard. And if we don't do something about it, they become the norm and not the exception to ways to be and operated. And at times, it is not intentional, maybe just out of curiosity or genuine naivety. When I was working at an insurance company in Cincinnati, Ohio, I was taking my lunch break and one of my coworkers, who happened to be a young, beautiful African-American, was smiling at me and she asked, Marife, you're not white, you're not black, what are you? In any other circumstances, I would have been very offended, but she was becoming to be my good friend. So I smiled back and I said to her, I'm an American. And I guess at the time, people worldwide don't know about Filipinos because I'm Filipino, I'm brown, until President Marcos became famous in the news and they know about Filipinos, right? So what I'm saying here is that it depends on who is talking. If it was a different person, I would have been really offended. So let's take a look at racism in nursing within the walls of the hospital, in the unit and bedside. Are you aware there is racism in nursing happening here? So I'm going to need your help with answering these questions based on your own experiences. So what I did, I asked some of my nursing colleagues and friends who are leaders here in the community here in Southern Nevada, and some of them shared their experiences. One of them told me she was told to go back home where I came from. This was in the early 90s. She was in California, and a patient told her this at the skilled nursing facility. Another friend said, those people are not Native Hawaiians. And they were referring to Samoans, Tahitians, Maybe historically true, but the attitude and behavior, the way it was said, was very demeaning. Then another friend and colleague said, some nursing colleagues demanded for us to speak in English, even during our lunch break. It's not even our working hours, it's our personal time. But remember, it's a matter of interpretation. So these are some cues and hints. Racism in nursing and clinical practice. Assignment changes at the request of patients. Families seeking care from a non-BIPOC or white nurses. And that covert racism that I mentioned, insult, slights, and presumptions of lack of competence and ability. I'm going to share you this. I know it's so tiny, but the case was filed in the year 2010. It's involving 69 immigrants who said they suffered constant harassment and humiliation when they opened their mouths or talked with family members on the phone. These nurses were banned from speaking Tagalog and other dialects. And during their 2006 mandatory meeting for Filipino staffers, nurses were told they were forbidden from using their native language at any time in the hospital. They were mocked for their accents and ordered to speak English only. And guess what? They filed a complaint and they won nearly $1 million settlement. So I'm sharing this because if you see it, you speak, you fight for your right, or nothing is going to happen. I know Dr. Beer talked about the 6 rules to address racism. She talked about this to address racism. And although she talked about it in the context of retaliation, I thought we can certainly apply these rules, the same rules, to address racism in clinical practice. Recognize, restate, remove, reflect, recover, and rebuild. But the key here is calmly, gently, and professionally addressing the situation after we recognize that it is racism. Remember the overt and covert. You can't sometimes tell. After we reinstate that, you want to clarify, what did you just say? Not only to make yourself aware, because you will know because there's something is not right. It also allows the other person to be aware of what was said because maybe it's unintentional. So this is really a basic technique in effective communication to address and focus on the situation that happened instead of attacking the person in the situation. It is only when there is this understanding of the situation that we can recover and rebuild relationships and trust. Sometimes it's a losing battle, I admit. If one does not want to change their attitude and behaviors, you can't do anything about it. You can only control your reaction to what was said or the situation. We can only keep trying to state our case and insist on our rights. I like this one. This is the key principles from the Substance Abuse and Mental Health Service Administration's guidelines. But this is for the trauma-informed approach, which we can really apply for racism in clinical practice, especially those who have been a victim of racism. So the authors utilized this framework for trauma-informed care in addressing patients' experiences of racism, creating a culture and environment of safety, that you are safe to call on someone when you feel that they're being racist, and maintaining that transparency and trust. Because if you have this transparency and trust, you'll be able to call on someone and say, hey, what you said really offended me, and being able to be safe in saying that. Most importantly, providing peer support and connection around racism. Like when you see someone is a victim and then you see it, you observe it, and then you went away. So that's not helping anybody. Also fostering collaboration between staff and patients, empowering patients and staff to speak up, and that promoting understanding of racism in relation to structural and historical factors. It is important in nursing because it does affect patients, how we feel. Okay, here, really the focus of this presentation that I prepared is really looking at yourself, looking from within, more on self-reflection. It's so easy for us to pinpoint, oh, racist, oh, he said something, this, but then we're not looking at ourselves. So let's do a self-reflection. I'm gonna say, are you guilty? So let's look at it. What are some moments when I committed microaggressions? Do I understand why this type of statements and actions are harmful and hurtful? For example, can I touch your hair? You have really curly hair. Wow, you speak so well. Where is your family from? And someone says, where are you from, Marife? I'm here from Las Vegas. No, where are you really from? I'm from Hawaii. No, where are you really from? Okay, I'm from the Philippines. I was born and raised in the Philippines. Okay. So are you guilty? Okay, the next one is, what racist thoughts, words, and actions have I had because of the way someone looks? Are you guilty? Have I ever witnessed someone make a racist joke or comment and not said anything? Are you guilty? Reflect on my social circle. Are they all international, different colors? So are you guilty? Am I aware of my bias when hiring, mentoring, or collaborating with others for work? Are you guilty? Reflect on how I react and respond to someone who is from a different ethnicity, or even the same ethnicity, but different regions, islands, dialect. Are you guilty? Am I guilty? So everyone is entitled to interpretation of what is being said, but we also have the option to see things in a positive light and think of good intention rather than evil intentions. And in time, you will know if the intentions are evil. It will present itself. So these are the 6 inspirational acts captured in outlines, how those in thriving environments behave in the world. Tell stories and never stop so that understanding can take root. Hold multiple perspectives without judgment because they are in a constant learning state. Reach and display sides of or visions that actualize their hopes, dreams, and unleash potentials. This is empowering each other. Ignite the world with integrity. Oh, I never said that. But you did, you said it, and it offended me. Speak the truth and be the truth. Validate the humanness and legitimacy in each of us, regardless of color, because we make mistakes. Other people make mistakes. I didn't mean it because it was embedded in them. It's hard to take it away or remove it. Erase labels placed on you or others that put people on paths, both intentionally and unintentionally. I always coordinate my clothes because someone said, oh, Filipinos don't know how to coordinate colors. So that was embedded in me. So we cannot, I guess, surviving racism in nursing is no longer inspiration or aspiration. We cannot talk our way out of what we behaved our way into. And this is how to thrive in the midst of racism in nursing. So I really like this one. We will be really misled if we think we can change society without changing ourselves. So that's how I thought how to address racism in nursing in clinical practice. We can start with ourselves. These are some of my references, and I hope I inspired you to look inside and ask yourself, Am I guilty? So thank you so much for your attention, and I hope I ignited that passion to address racism in clinical practice.